Hi, Ms. Hill.
Hi, Pasha. Are you ready to give the vaccine to Mrs. Khan?
Yeah, I'm just double checking the facility policies on pneumococcal pneumonia vaccine. I felt comfortable when we prepared the injection in the medication room, but I just want to be sure I'm ready to provide any teaching if my patient needs it. She's 66 years old and hasn't had the vaccine in over 5 years. As we discussed, it's to be administered via intramuscular injection at the deltoid site.
Most facilities prefer the deltoid site for immunizations and the ventrogluteal site for other intramuscular injections. It's always good to verify the order and the hospital policy first. How would you respond if the patient asks you why you're giving the vaccine using the intramuscular route?
Well, muscles have bigger blood vessels than subcutaneous tissue and more of them. So the intramuscular route allows for faster onset of action than the subcutaneous route.
Correct. The intramuscular route is chosen when a reasonably rapid systemic uptake of the drug is needed by the body and when a relatively prolonged action is required.
Right.
So let's go give that injection.
Okay. Hi, Mrs. Khan. We're back.
Hi, Pasha, Miss Hill.
Hi, Mrs. Khan.
As we discussed a few minutes ago, I'm here to give you your pneumococcal pneumonia vaccine. It lowers your risk of getting a certain kind of pneumonia. The vaccine is recommended for people over the age of 65. I have the consent form you signed right here.
Yes, I've reviewed the materials too. I didn't realize there was a vaccine to help prevent pneumonia.
I understand it's common for people to forget or not be aware of the vaccine. It looks like you actually received it about 10 years ago. Current recommendations indicate that since you're an adult over the age of 65, you should receive the vaccination again. We're going to give you the shot in your upper arm, okay?
Okay.
So, since you reviewed the patient education, do you have any questions about the vaccine?
No questions. Although being in the doctor's office is not fun, at least I'm leaving with a plan and I'll also be vaccinated against pneumonia.
Good. Let me just check your identification. Can you state your full name and date of birth for me?
Mrs. Farzana Khan, May 23rd, 1950.
Great, thank you. I'm going to check the medication label for the third time really quickly. So I have the right patient, the right medication, the right dose, the right route, and the right time.
Good.
I see you don't have any allergies.
No allergies.
Good. I'm going to write down the lot number and manufacturer of the vaccine on the required form, as well as the other required information for Mrs. Khan's record.
Good job reviewing the requirements at this facility, Pasha. You did a good job using your resources, your computer, your nurse, and me.
Thanks, Mrs. Hill. I'm ready when you are, Mrs. Khan.
Let's get this over with. Can we use my left arm?
Sure. I just need to do some hand hygiene and put some gloves on, okay?
Pasha, what length needle are you using and why?
The patient is an adult with the medium build, and we're using the deltoid muscle. In general, the needle is 5/8 to 1.5 inches long. The needle choice is based on the specific patient, with the goal being to ensure reaching the muscle, but not bone. IM needles are typically between 20 and 25 gauge for aqueous solutions and biologic agents, based on the medication, the site, and the patient. For this patient, receiving a vaccine in the deltoid, I'm going to use a 22 gauge 1-inch needle.
Good. Obese patients may need a longer needle, while emaciated patients may require a shorter one. What's next?
Now I will select the appropriate administration site, which, as I've mentioned, is the deltoid site.
Good.
Okay, Mrs. Khan, I just need to roll your sleeve up a little bit more, okay?
In order to avoid complications, you need to be able to identify anatomic landmarks and the boundaries for the injection.
Okay, so with my left hand, I place 3 fingers below the edge of the acromion process of the scapula. That's my injection site right there. I'm going to clean the area first.
Okay, let me double check and palpate the muscle you'd like to use. Feels good, solid muscle. Okay, you may move to prepping the site. Start at the center of the injection site and move outward with firm circular motions. Good. Leave the alcohol pad on the arm with the tip pointing toward the center of the area you just prepped. That will help you mark the injection site.
I love that trick. This vaccine injection in the deltoid does not require the Z-track method, so I plan to simply pull the skin taut with 2 fingers to ensure the needle is in the muscle.
I agree, but can you show me how we would use the Z-track method since we're working through IM injections anyway?
Go ahead, Pasha. We all have to learn sometimes. Use my arm and show Miss Hill how to do the Z-track thingy.
Thanks, Ms. Khan. I appreciate your patience and willingness to work with me. So, I would displace the skin with my pinky and hold the skin and underlying tissue down. Then I would dart the needle in at a 90-degree angle, hold the base of the needle like I would for any IM injections, but I would be sure to keep the skin and underlying tissue displaced. I'd inject slowly, 10 seconds per milliliter, hold the needle in place for 10 seconds, and then remove the needle and release the hold on the skin.
Excellent demonstration.
Good job, Pasha.
Now let's move to the actual injection for Mrs. Khan. Follow the same steps you just outlined with the exception of displacing the skin.
Since I touched the injection site for that little demonstration, Mrs. Khan, I'm just going to prep the site one more time. Right there. And I'll just make double sure I did not accidentally displace any medication while I was handling the syringe.
Okay, looks good.
All set, 0.5 milliliters. And I'll get the gauze pad ready where I can easily reach it.
Good. Go ahead and uncap the needle with your hands in the double OK position.
Got it. To avoid an accidental needle stick, I take the top straight off like so.
Right. Now hold the skin taut and administer using the dart motion we reviewed. Let your wrist break and dart the needle in.
90 degrees perpendicular to the skin. Okay, you're going to feel a quick pinch, all right?
Use the thumb and the forefinger of your non-dominant hand to hold the bottom of the syringe. Slide your dominant hand to the end of the plunger and slowly inject the medication.
I instill the 0.5 milliliters of medication over 5 seconds. Then I'll withdraw the needle and activate the safety. Some administrations require holding the needle in place for 10 seconds after the injection to allow time for the medication to diffuse. But that is not required with this vaccine.
Excellent work.
I'll apply gentle pressure with the dry gauze.
I hardly felt that at all.
Thank you.
No, thank you.
Good job, Pasha.